The need is enormous for our children and our families.
What we've seen is this dramatic increase in anxiety and depression, and pediatricians we know are the front line of taking care of those patients.
Child and adolescent psychiatry is severely underserved here in Tennessee and across the country, leaving pediatricians with having to provide care for children with psychiatric conditions.
My specific interest focus is in the developmental pediatrics area. We don't have a lot of that training, and so to decide kind of which medication a child needs, it would be kind of making a referral, and a wait list can be really, really long.
People with mental illness, people struggling with emotional issues don't really have the time to wait.
The TCAPES consult line bridges the gap for providers and their patients so that they can feel more well-equipped to handle behavioral health issues in the office.
It is a service line where we offer phone calls available to clinicians across the state, pediatricians who are family medicine docs, or really anybody who's interested in getting some more support for providing psychiatry access to their patients.
I had to contact them one day about a patient that had refused to eat because he had an extreme fear of choking while swallowing, and we were at a loss on how to best help him because he was a very young patient. So we were able to utilize the TCAPES line and speak to the psychiatrist, and she helped us understand the options available, the best medication to try to use for him, how to monitor that, and how to change the dosages as needed. And he's now eating successfully, and we're at the process of weaning medications for him. So that was definitely a success story for us.
A lot of primary care providers or pediatricians aren't really comfortable with psychiatry, and this is a great way to help them feel more comfortable and more confident in the care that they provide to their patients.
I think for all of us, we come to a place sometimes where we're like, man, I feel like I'm at the limits of my knowledge or experience, right? And it feels defeating for me as a provider. It feels defeating for my patients. So the ability to call TCAPES and say, here's what I've got going on. Can you give me some feedback on what to do next? I know I've got an expert in the field, and that really brings a sense of hope to my patients.
Calling the TCAPES line is so easy. I have some kids that are, complicated, sometimes kids on the autism spectrum, and also with a diagnosis with attention deficit, with or without the hyperactivity, and getting those medications right can be really hard. I know that I can reach somebody quickly and go ahead and provide that family some help.
In addition to the consult line, TCAPES offers a training we call BHIP TCAPES. This training is 2 to 3 hours long. It could be virtual or in person. The training's delivered by one of our BHIP trainers who is a board-certified practicing pediatrician in the state of Tennessee. During these trainings, we cover various topics such as trauma in the developing child, psychopharmacology, and other behavioral health concerns such as anxiety and depression in youth. We want everyone to feel comfortable and confident in seeing these patients in clinic.
I encourage any and all pediatric providers in the state of Tennessee to give the TCAPES line a call just to see if it would be beneficial to you in your practice.